Hi, I'm Dr. Neil Shah, a partner at Northwest Cancer Center from Rush University Medical Center, and I'm a board-certified hematologist oncologist. This is the first podcast of many of trying to engage our community and interview our doctors and provide some knowledge to the community about certain things. Today we're going to be talking about COVID and cancer. I have my friend and colleague, Dr. Michael Tallarico from University of Chicago. And he recently did a presentation at Munster Community Hospital about COVID and cancer. Nice to see you.
Yeah, you too. I mean, it's been a whole 5 minutes. So,
Yes,
yeah.
exactly.
Yeah.
Well, the first thing we do on this podcast is we try to learn if people have good taste in music. So I'll be playing a song for you, and you would have to recognize the song. So let's just see if we can hear it.
Well, it's obviously The Boss, Born to Run.
Well, obviously you have excellent taste in music. I also love that song, and unfortunately we haven't been able to run much in the last year and a half because of COVID. I know you and I didn't miss a day of work.
Right.
We kind of fought through, even despite, at least my wife would make me strip down naked in my garage when it was cold. I don't know if yours did too or not.
Oh, yeah.
Yeah.
Oh, for COVID reasons, yeah.
Absolutely, and we're happy to make it through, learn more about how COVID is spread. Unfortunately, and you'll have to tell me if it's true for your case, I lost more patients to COVID last year than cancer.
I'd have to say it was tough, and any of my patients with cancer who ended up in the hospital, it was a tough course. So I've been trying our best to kind of prevent it from happening in the first place.
Yeah, I've been reading some stuff online, which is always, not sometimes accurate information, but not always.
Yes.
One of the most common questions that people are a little afraid of, which I can understand, especially if you're dealing with cancer, is, will the COVID vaccine make your cancer worse?
No, there's absolutely no data to say that, which is great. And when you look at it in those trials, these phase 3 trials, we have equal groups on both sides. No one with cancer did worse. In fact, giving protection to them, they're actually a lot of cancer patients, especially with blood cancers, at higher risk. So even better reason to get vaccinated.
I know a lot of families are getting together for Thanksgiving, and I've been faced with this question over the last couple of days: is if we have, people haven't seen their families, and there's some people that just won't get vaccinated, and we know now that I think, correct me if I'm wrong, that half the world has been vaccinated. Is that right?
Yes.
So what advice would you give to those people that maybe are going to get together with some family members that are unvaccinated?
I'd say be very cautious if you are going to, and I mean, obviously it's a personal choice of the risk you take. Maybe ask those other family members to get tested beforehand. Make sure they avoid exposures, especially if you're seeing them, and maybe have a talk to them about even getting vaccinated if they're open to you, because a lot of times you want it to come from a trusted source, and who better to hear it from than family if you've already been vaccinated. But you want to be careful in all these situations.
Yeah, my kids just got vaccinated. I have 8-year-old twins, and I guess one of the things is we went on a family trip this past summer to Michigan, and my son had a little cough and stuff, so we actually took those home kits and had them tested before we went. Would you recommend something like that?
Yeah.
Do you think they're pretty accurate, or?
I think they're pretty good. If you have symptoms, they're very accurate if you're symptomatic. For asymptomatic people, it still can pick it up. They may miss a few, but it's pretty good, and it's a lot easier for people to do as long as you just follow the directions to the T on there.
Absolutely. I mean, it's going to be a great holiday. I think we're all going to get together with our family members. We want to wish all of you a happy Thanksgiving, and just make sure that you have some good music like Bruce Springsteen at Thanksgiving. So, hey, thank you, Dr. Tallarico.
Yeah, thanks for having me.
It's been my pleasure to work with you, and every week we'll kind of meet with other physicians and get their updates on things. And I don't know if you have anything else to add.
No, have a happy Thanksgiving. Don't eat too much.
All right.
Enjoy, guys.
Hey, take care, guys. This is episode 1. We'll be back in a month with the next episode.